that I can get started.
Okay, you're all set.
Great. And just before we get started, I just wanted to double check with you about speakers to see if everyone's here for us to get started.
Yes, it looks like the speakers are here. Just for the announcements and informational updates portion of this meeting, Deborah Louise is on and Padmore is on.
And I see we have Robin as well. Great. Okay, I'm just going to go off screen for a moment so I can pull up our remarks and start reading them to get us started. Oh, I forgot that you have a great slide. That'll do it. So good evening, everyone. My name is Nye Whitaker, and I am proud to be the chair of our Health and Human Services Committee. This is our October meeting. I just want to make sure that we take a few minutes to set some ground rules so that we can have a productive and engaging meeting and make sure that we create a safe space, both for those who are presenting and sharing with us this evening, for our fellow members of the Health and Human Services Committee and any other CB11 board members that may be participating, and of course, for our community members and members of the public that are here. With that being said, no one may speak until the floor is granted. What that means is that if you have a question, we ask that if you're a participant, that you go to the participant's icon and click and use the raise the hand function. If you're having any technical difficulties, you may click the chat icon and relay that difficulty to the staff. Marlene, who is our liaison from the CB11 district office, will then respond to you. The only information that should be in the chat is information from our speakers and presenters. I will ask them to drop any of their phone numbers, emails, name of the organization's website, and anything else pertinent, links, etc., to upcoming events or ways that we can engage with them into the chat. Please do not put questions in the chat. Please refrain from putting comments in the chat. And please make sure to stay positive and respectful. Marlene, can you move to the next slide? Great. So Marlene, I'd like to call the meeting to order.
Sure, what time?
It is exactly 6:08 p.m. And I'd like you to ask to assist with our roll call.
Sure. Eva Chan?
Present.
Thank you. Osendi Garcia? Robin Krinsky?
Present.
Thank you. Patricia is excused. Jennifer Meyer?
Present.
Shirley Pena? Arturo Perez?
Present.
Thank you. Xavier Santiago?
Present.
Isaac Scott? Robin Strachan?
Present.
Thank you. And Nye Whitaker?
Present.
Thank you. You have quorum. Nice.
Great. Thank you, Marlene. Just going to go and ask if we can have an adoption of the agenda for tonight's meeting. I'd like to open up to the committee members. If I could get a first and a second so we can move forward.
You don't, sorry, Nye, you don't have to ask for a first and second. If there is an objection, then you would go into a vote. But if there is any, you could do unanimous.
Great. So we can do a unanimous verbal voice vote. So first I'll ask, are there any objections to the adoption of the agenda for tonight's meeting? If so, please raise your hand. Seeing none, I'd like to then call for a verbal vote to move forward with the adoption of the agenda for tonight's meeting.
Aye.
All those in favor, please say aye.
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 Okay, thank you, everyone. I'd like to then move to an adoption of the September meeting minutes. Marlene, for that, does that have to be a direct vote or can that also be a voice vote?
Right, it could just be a voice vote. If there is an objection, then you would vote to vote for it.
Thank you. So first I will ask, are there any objections to the adoption of the minutes from the previous month's meeting, the September meeting? If so, committee member, please raise your hand. I'll give it a few minutes. Seeing none, I'd like to then move to a verbal voice vote for the adoption of the September committee meeting minutes. You can please vote aye.
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 All in favor? Aye. Great. Great.
Aye.
It didn't sound like everybody, but I didn't hear any objections, so we're going to move forward. So first on the agenda, we have some announcements. We had a conversation with the CUNY School of Public Health, and they have some updates regarding their COVID-19 initiatives. So Marlene, who is the speaker from the CUNY School of Public Health?
Deborah Levine.
Great. Deborah, the floor is yours. You have 2 minutes.
So I'd first like to say thank you very much, Community Board 11, for allowing me to come and speak this evening. Sorry, I'm just slightly hoarse from allergies. I am super excited to let you know that the SUNY School of Public Health and Health Policy, I am their director of the Harlem Health Initiative, and we currently are in the process of updating our website to include all of the surveys that we have been convening around COVID and mental health, and COVID and other health disparities on our website. But what I'm really here to talk to you tonight about is our upcoming webinar series. We have 3 webinars looking at different aspects of COVID based on the information that we've received from our surveys that the community members would like to hear about. One of them is looking at the research around parents and their concerns around children, COVID, and the vaccine. And that's on coming up this week on Thursday evening. We have a Train the Trainer for young people who want to be able to learn and talk about COVID with their peers, and also for staff who would like to better be able to convey science-based, culturally competent, and linguistically sensitive information about COVID testing and COVID vaccine. And that is on November 16th. And then on November 17th, we have another webinar coming up on structural racism and policies around economics of COVID-19. And I'll be happy to drop that information into the chat. And I look forward to being able to participate in further meetings throughout the year. Thank you.
Thank you and welcome. Yes, please feel free to drop your full name, the name of the program, your email, if there's a website, and phone number into the link, as well as any dates and information. Also please feel free to email to Marlene any flyers or invitations that we can share out through the CB11 newsletter. So thank you very much for sharing that. We look forward to continuing to engage with you in this new initiative.
Thank you very much.
Don't go just yet. So I'm going to open it up for any questions from the members of the Health and Human Services Committee. If there's a member of the committee that has a question, if you could please use the raise hand function so that I can call on you. Okay, I'm not seeing any right now. Marlene, are you seeing anything?
No, I don't see any hands raised.
Great, so then I'm going to open it up to any members of the community that may have, or the general public, a question. If you could please raise your hand and wait to be called upon. I don't see any. So we're going to move forward to the next item on the agenda. Thank you so much, Deborah.
And thank you.
Great, thanks Marlene for advancing the slide. Next up, we have our standing presentations from our partners at the New York City Department of Health and Mental Hygiene and updates regarding COVID testing, vaccination, boosters, third shots, outreach and events. So I'm going to turn the floor over. I believe that Padmore John is here and or a member of his team for the presentation. Padmore, are you here? I saw you hop on.
Good evening. This is Rachel Danifer, and Jaime Gutierrez is on with me, although it says Padmore John on his video for some reason.
Oh yeah, I saw it say Padmore, so I thought that was him joining. Hello, Rachel. Hello, Jaime. How are you?
Oh, and it says Pad. Oh, so we must be affiliated with his name. So, and I know Padmore is listening, but I believe he was going to leave the speaking up to Jaime and myself tonight. We both work with Padmore at the Bureau of Harlem Neighborhood Health and are part of the East Harlem Action Center that's at 115th Street and Lexington Avenue. And we wanted to join you this evening because we've been doing a series of interviews or listening sessions with partners and coalitions and other groups in East and Central Harlem to hear about experiences with COVID and also to kind of get your input on what you would like to see from our Bureau and our Action Center. So unless Jaime wants to make any kind of broader announcements, I can dive right into that part of what we wanted to talk about. Okay, and can you just remind me how much time do we have for this part of the agenda? I just want to be respectful of that.
I'm going to double check with Marlene on that because I know we usually give you guys a few extra minutes in our program. So Marlene, and I also want to allow time for questions. Marlene, I've got 6:17. How many minutes do we have available? Because I know we have a presentation by Robin and we also need to get through the budget items.
Right, so Robin's presentation is under the presentation and discussion portion. This is informational updates, and 7 minutes was allotted.
Right.
Yes.
So what I usually like to say is, can you do it in 5, and then we leave a few minutes for questions, and then we're always able to continue the conversation, afterwards.
Okay. Sure. I think in that case, we'll do kind of a very abbreviated version of what we usually do. And if it's okay with everyone, I would like to record this part just for us to kind of help with our note taking. Does anyone object to that? I see the whole event as being recorded. So I'm just going to turn it over to Jaime, I think, to ask about maybe some of the most important questions would be like, what would you like to see to support recovery in the neighborhoods where you work? But Jaime, I will turn it over to you.
Thank you. Good evening, everyone. So we will do a very abbreviated version of the interview guide.
Jaime, I'm not hearing you so well. I don't know if anybody else is having an issue.
He's clear. I can hear him.
Okay. Great. Just want to make sure we can catch it for the recording and the notes. Thanks.
Mm-hmm.
So I'm good. We're good. Okay. So we, as Rachel says, we are. This is an interview guide that we are using with partners in East and Central Harlem to determine. To get information about what COVID recovery means to folks and how we as the Harlem Bureau of Neighborhood Health can support CB11 and how you all can support us in COVID recovery. So the first question, kind of broadly speaking, when you think about COVID-19 recovery in East Harlem, what does recovery mean to you?
And are you trying to pose this so that the community is answering, Jaime?
That's correct.
Okay, so I think that it would be great if perhaps you could kind of read through all of the questions and let's pose them. And is there some sort of survey or link that you can send to us that we could share out with the community vis-a-vis our newsletter? Because we usually don't just open the floor for general discussion.
I mean, I can share my screen, Rachel, if that's okay.
Yeah, that would be great if you could share your screen, and let's put in front of both the committee and the public that is joining us what your key questions are and the information that you're trying to gather. And then if you want, you can share the larger presentation and any other links with us that we could then share out to the larger audience of CB11.
Okay, it says I can't share because
Marlene, could you give him permission, please, to share his screen?
Are you all able to see my screen?
Yeah, it says that it's Pat. It says Padmore John has started to share his screen.
Okay. We're Padmore and we're the dynamic trio. Me, Rachel, and Padmore. Okay, so this is the interview guide. Rachel just kind of went through that consent portion. And what we'd like to do is kind of get right to the meat and potatoes since we have such a small amount of time. And we'd like to know, when you think about COVID recovery, what does it mean? What does recovery mean to you? What does the recovery look like in East Harlem? And then what do you think is needed more broadly to help residents and the neighborhood overall recover from the impacts of the COVID-19 pandemic? We'll start with that.
Okay. So Marlene, for the purposes of this, should we open up the chat and allow people to put comments into the chat that Jaime and the team can then take with them? Because we usually don't open up the floor for general conversation.
No. So Jaime and Padmore, Naya just sent you a message if you want to read it.
Oh, okay.
Asked via email if this is what you intended to do, which was give a survey on the floor. So what we generally do is put that on the agenda so the public has notice.
Okay.
In regards to what the committee is going to speak about regarding this specific agenda item, and
Okay.
also to give the committee members time to have a sound answer for you. So right now, then I'm pretty sure they're more than capable to get come up with an answer for you right now, but it's going to be rushed. And we want to give you all time and to be able to, you know, present this to us in a way that you have time and not be rushed, because this is pertinent information. It should not be rushed. You shouldn't only have 5 minutes for it. Nye, I'm not sure if you want to welcome them back to speak about this specifically next month. Your call.
What I would
I don't
love
think
to,
this should be rushed.
yeah, I agree. And also I'm just not sure of the format, you know, of the best way to do this. So what I would love to say is I'd like to ask you, Jaime, if you could send us a larger presentation, depending on what your date and deadline is. I'd love to have you guys come back next month and give you a longer, you know, 20-minute or whatever the segment is that you guys fully need. But in the interim, I would invite the committee members, if there are any members of CB11 Health and Human Services that would like to pose an answer to the question now in terms of what they would like to see for the recovery from, you know, DOHMH or the East Harlem Health Action Center. I ask that you please raise your hand now, and I will allow a few minutes if anyone would like to comment now. Otherwise, I think that I'd love to have a longer discussion, comment, and hear the full presentation of the survey as well, and not be rushed, as Marlene said. So I think we have you down for a limited window because of our budget discussion for this evening.
Yeah, I think it's a great idea to invite.
Thank you, Jaime, for your flexibility. Jaime, are there any other updates to share coming out of the East Harlem Health Action Center?
Yes, let me see if I can. So as you all know, we are a vaccination site. We offer Moderna, Pfizer, and Johnson & Johnson. We're currently still giving the $100 incentive to those families who come in for their first dose of any of the vaccines. We are preparing to get the Moderna booster, and we are preparing to our site to vaccinate children. All of this will be coming in the next couple of weeks, and so we are. That's currently the work that's happening at the vaccination site.
Great. And just remind me of the days that you guys are open.
We're open Monday to Saturday from 9 a.m. to 6 p.m.
Awesome. Thank you so much. If you could please just drop your contact information into the chat, and Marlene will be in touch with you guys to reschedule for the longer full presentation. And if you have the availability to share the fuller presentation with Marlene, that'd be great. I see that Eva, your hand's been up for a while. I didn't realize it earlier. Is it something that's pertinent to this, or was it something previous?
Yeah, it's related to this.
Great.
My question has to do with, since we're about to talk about the budget, I wanted to know what are the key area that you feel like more funding is needed to help the East Harlem residents. And before I say that, I'm going to give a shout out to your center, because we've been working together on supporting Asian seniors, and you guys have done such a tremendous job. It's very, very much appreciated, your work.
Thank you. Thank you. Oh, yeah, we were just talking about that actually in a meeting earlier today. So in terms of, I think that's part of what, so the most important question I think for us here is how can we as a Harlem Bureau be supportive in recovery efforts? And so it's, I don't know that I have any feedback, and Padmore, I know you're listening. If you want to chime in, please do. And Rachel, what are your thoughts? I think it really, like, we'll share the instrument, and we will have a more meaningful conversation about this. Sorry, Eva, I know I can't, because it's such a short amount of time. I don't feel like I would do it any justice.
I think just to follow up on
today, that's fine.
Yeah, just to follow up on Eva's point, our budget items are due by Thursday. So please feel free, if there's information from any of your other presentations, if there's anything, that kind of sticks out, you're welcome to email us so that we can incorporate it into our, planning for the upcoming session.
I'm sorry I didn't reach out to you, but I second guessed you. So for the budget proposal, I added 2 items. One is more funding to increase awareness that vaccination is needed, because it seems like more rounds of vaccination will be needed. And then also more funding to support Asian seniors due to language barrier. But let me know if you want to add anything else. Thank you.
Great. Is there anyone else whose hand is raised, Marlene, that I may have missed?
No, I don't see any hands raised now.
Okay, great. So thank you for that presentation. I look forward to having you back next month. And again, let's continue this dialogue, because I think it's important. Don't mean to rush us along. It is way too important. And again, I just want to make sure we have full time to discuss it and to get to the rest of the presentations on the agenda. So Marlene, I can't see the agenda slide for some reason anymore. Can you just tell me what's next up? Oh, here we go. I got it.
Okay, no problem. I will read it if you need assistance.
I've got search and care. So Joseph, is it DiBenedetto?
Yes.
Welcome, Joseph. And the floor is yours.
Okay, yes, so I'll be quick and I'll leave room for questions. Just letting
you
you
have 10 minutes. So I usually say, if you can do like 5 to 7, and then it gives you more time for Q&A.
That's totally perfect. Yeah, so I'm representing both Search and Care and the East Harlem Community Health Committee. I was recently appointed the chair of the Older Adult Subcommittee. And essentially, we had a meeting with DFTA and learned that there was a lack of data or knowledge on how COVID-19 has impacted older adults in East Harlem. So we decided after that meeting with DFTA, a group of us, to come together and brainstorm on what we could do. And essentially what we decided to do was branch off a survey that was already existing with Mount Sinai called Speak Up on COVID. So this is essentially, as I said, a branched off version of it, but it has more focused and centered questions for older adults and things that may pertain to them, like home care and different things. And essentially the idea is to, one, gain that preliminary data on how older adults were impacted from COVID in the area. And then two, hopefully use that data to identify needs or resource gaps. And then three, use that data to hopefully advocate based on what comes out of the data. So there's, I guess, three different objectives that are coming from this. We are looking for people that are 55 plus that are interested in taking the survey. We are using CB11's parameters for what we're categorizing East Harlem as, besides Roosevelt Island. And we are allowing the Stanley Isaacs residents that are right below 96 to be included in it, due to some advocacy on the residents in that part to be included in it. And we are allowing the survey to be taken either online, snail mail, or have it telephonically administered. So if you're interested, you can reach out to me or one of the other partners, and I can put my information in the chat. And it's also available in English and in Spanish.
So Joseph, is there a deadline for the collection or when the data is due?
I believe we're doing this for several months because we received a grant. So the deadline's not anytime soon. I think until February. Oh, and also I forgot to mention that
The incentive.
yes, the participants get a $20 gift card.
Awesome. To Eva's point earlier, is there any opportunity, especially when you talk about the Stanley Isaac Center and kind of going to the south and further east part of our district to have the survey translated into Mandarin or another one of the Asian languages so that we can invite the Asian members of CB11 to participate?
Sure. I mean, if there's somebody that's willing to help us translate it, yeah, I mean, we don't have anybody part of the team that speaks any of those languages, but if there's someone that would help us do that, I'm open to it. Sure, why not?
So Eva, I'm just going to ask if perhaps you could reach out to Joseph as a follow-up to see what we can do to make sure that all of our community members are able to participate in their language of choice. Joseph, is there anything else?
No, that's it, unless people have questions, and I can input my information here.
Okay. So I'm going to ask you to drop your information into the chat. I don't know if there's a link also to the survey. And then I'm going to open up for questions from the committee members. So are there any members of the Health and Human Services Committee who have a question or comment? And if so, if you could please raise your hand and wait to be called on. Okay. I'm not seeing any. I'm going to open it up to the members of the public. Are there any members of the public who would like to ask a question or make a comment? Okay. All right. I see Brenda Black. I'm going to recognize Brenda Black. You can unmute yourself.
Hi, how are you? Good evening, everyone.
Good evening.
I had a question and a comment. My question is, the grant that the EHCHC received, is that a taxpayer-funded grant? And then my comment is that it's very easy to make translation these days online. You can even just go to Google Translate and put in the original text, and then put it in and have it and translate it to Mandarin or Cantonese. It might not be exact, but it'll be close enough that those readers will be able to read it.
So thank you, Ms. Black. So the first, I'll answer the second question about the translation. I'll address that, Joseph, but if you could address who's funding the grant that you have for the survey? You're on mute.
Thanks. Yes, so Robin Hood Foundation is funding this opportunity. And I'll be honest, I don't know exactly too much about it because it was Search and Care and the Institute for Family Health that were the subcommittee working on this survey, and the Institute for Family Health actually is holding the grant. So I'm not sure about some of the other details.
I see Robin nodding, so you did good. You did good, Joseph.
Yes, and the
Regarding
grant
the
is Mhm.
regarding
Yeah.
the translation, thank you, Brenda. I would just say that I always tell people, someone who's been in the field for 20 years, be careful with Google Translate. So I would like to thank you for the recommendation, but because this is a survey that is being funded and that may have more technical questions, it's best as we build alliances with our community members to have it translated in a professional way so that as not to offend and or confuse. I think Google Translate is great for quick stuff, but I would think for this kind of survey, it would be best if we had some more professional services. So again, asking Eva Chen, who's one of our committee members, to follow up with Joseph to see what assistance can be provided, because Eva has been working to better engage our Asian community members in CB11. I don't see any other hands raised, so I'm going to thank you, Joseph, and thank you by extension, Robin, for inviting our community to participate. If there's any links or information that you would like us to include in the next CB11 newsletter, please feel free to send them over to Marlene so that we can help amplify and promote this unique opportunity. I'm now going to move on to the next item on the agenda. Marlene, could you advance the slides? Great. So we have a present.
Okay, I just wanted to know what you were seeing.
Yeah, there's just a little bit of a delay on my end. So we have a presentation from the New York City Department of Health and Mental Hygiene on harm reduction and overdose protection, or I'm assuming it's protection or prevention. Prevention, I was thinking. And I'm so sorry, it's Dr. Chinazo Cunningham, is that correct?
Yes, yes.
Thank you, welcome, and the floor is yours.
Thank you. Can I share my screen too?
Yes, you should have permission to.
Okay. So thank you so much for the opportunity to be here and to present about harm reduction approaches to substance use and overdose. I'm Chinazo Cunningham. I'm a physician in internal medicine and addiction medicine. I'm the Executive Deputy Commissioner of Mental Hygiene in the Health Department, and prior to that had been working in the South Bronx for over 20 years in a community health center there. So I'm going to just talk about overdose deaths. So right now in New York City, every 6 hours, somebody dies of a drug overdose. That number continues to get worse. These are data from 2015 to 2020 that show the number of overdose deaths. And if you look to the right of the screen, 2019 and 2020, what you can see here is the number continues to increase during the COVID pandemic. So we don't have final data yet for 2020, but you can already see that the total number of deaths in the first 3 quarters of 2020 were really about the same as in 2019. So we know this will be the deadliest year ever on record. What we also know is that what's driving these overdose deaths is fentanyl. And so this line in pink shows that as of the end of 2019, over 70% of deaths were related to fentanyl. Who is dying of overdose deaths? Predominantly men, more Latino than other groups. You can see about equal number of Black and white individuals and a very low number of Asian individuals. And then you can see in terms of the age distribution, the age range of 35 to 54 is most common. Very important is this map showing the rates of overdose according to geography. And we know that obviously the both overdose and addiction are not equally distributed throughout New York City. And so the darker the colors here are the higher the rates of drug overdose death. And of course, you can see East Harlem is one of the highest areas of overdose deaths. So what's our response? So I cannot talk about addiction or about overdose without talking about stigma and equity. And so really, it's through these lenses of ensuring equitable treatment and an equitable approach by reducing stigma and providing evidence-based interventions that the health department works within. So what is harm reduction? It's a practical set of strategies that reduce the negative consequences that are associated with substance use. It's centered on human rights. And it's really a continuum or a spectrum of strategies that range from using substances safely to managing substance use to being totally abstinent. It also meets people where you are. Really, it's through the harm reduction movement that it got us to syringe exchange programs, which then paves the roads for overdose prevention centers. So through the New York City Health Department, we launched Healing NYC, which was a $60 million investment that was announced by the mayor in 2017, with additional $9 million added in 2021. And it's a multi-pronged approach with multiple city agencies. Some of the, wait, I'm sorry. I'm just trying to figure out, actually, could we, let me, you know what, I'm gonna stop sharing for 1 second and actually just, sorry, there was some technical difficulties here. Sorry, okay. I just want to talk a little bit about the harm reduction strategies that we have and the NYC, Healing NYC, which was really to make sure that we know what's happening in terms of our data, that we really highlight that fentanyl is present and make sure that people are aware. We want to expand services, evidence-based services to treat addiction, and that includes in our syringe services programs, that includes in emergency rooms, that also includes distribution of naloxone, life-saving medications. And we want to also promote and expand the peer workforce to increase recovery. So that brings us to overdose prevention centers. And so overdose prevention centers are an evidence-based strategy that reduce overdose deaths, and it's part of the continuum of harm reduction. Overdose prevention centers are safe, clean, supervised facilities where people can use drugs. They provide education, equipment, and oversight of drug use. And they really, really connect people with care and social services. And so it's a part of a continuum when thinking about the harm reduction continuum. We also know that there's evidence to show that overdose prevention centers reduce deaths in the surrounding neighborhood, reduce public drug use, reduce syringe litter, and increase people connecting to care, including primary care. In addition, it also saves money. There are over 60 jurisdictions across the world that have successfully implemented overdose prevention centers. And in 30 years of having these open around the world, there has not been a single death. In the United States, there's a lot of interest that's growing, not only in New York, but in Philadelphia, Seattle, San Francisco, Rhode Island, and other cities. We also know that overdose deaths, overdose prevention centers would improve the health of New York City. There has been a study that was released in 2018 that shows that by opening 4 overdose prevention centers, we could prevent anywhere from 67 to 130 overdose deaths annually, and that we could save up to $7 million in costs. So New York City supports the implementation of overdose prevention centers to address the continued worsening epidemic of overdose deaths. This is really one part of a continuum of services that will reduce deaths, will improve public safety, and address community concerns. So thank you, and I'll take questions if I have some time.
Great, so thank you for the presentation. I see that my fellow colleague Pauline is on here. Hello, Sister Pauline. Thank you for dropping that information into the chat. I'm going to open it up for questions and comments to our committee members by raise of hand. I see Eva, your hand is up first. If there are any other committee members, please use this time to raise your hand so I can queue up the series of questions. So Eva, the floor is yours.
So today, what are you asking for? You're asking to add an overdose prevention center in East Harlem, or just support for the prevention center to be set up in New York City? I believe that 4 sites have been chosen already.
Right. So so we're talking to many community boards about this, especially those neighborhoods and where overdose rates are the highest. To really just talk about this as one additional sort of tool in the toolbox that's evidence-based and that is a continuum of the strategies that already exist. So we're still exploring, exactly where and sort of next steps, but the city absolutely is committed to really doing every single thing we possibly can that's evidence-based to address this worsening overdose epidemic.
Another related question I have is, the public data seem to indicate that East Harlem ranks number 5 in New York City in terms of overdose. And it's below 4 other districts. They're all in South Bronx. So I think in your presentation, it might be useful to clarify that data, because there's a history of kind of overstating the drug usage in, not you per se, but media and whatnot, overstating the drug usage and overdose in East Harlem, causing our compassionate residents to believe that we need more drug treatment centers.
Thank you. I appreciate that point. So you're absolutely right that in 2019, that East Harlem was ranked 5th in terms of the rate of overdose deaths. In 2018, it was actually ranked number 1 in overdose deaths. We don't have data yet for 2020, but I think really the health department, we use our data to really try and target resources, right, and address the needs of the community. And so we do know that East Harlem has been among the top in the last several years, but you're right, in 2019 it was number 5.
And so can I just ask a follow-up question in terms of the data, Dr. Cunningham? Do you have any anecdotal or factual references on the factors that would have led to the reduction, in East Harlem moving from number 1 to number 5, which I think is good news. But do you have any, sort of kind of theories on what caused that change?
Right. Well, so it's hard to sort of attribute, one thing, especially when there are many things that have been happening to address overdoses. And so really taking all evidence-based approaches, there has been a lot of investment in expanding treatment access. So that's buprenorphine, methadone, naloxone, all evidence-based medications. There's been additional support for syringe services programs. So expanding their drop-in centers, funding outreach, to really connect people to care. There's been campaigns to make sure people are aware of fentanyl, right? Because that's really what's driving a lot of overdose. So making sure that people know it's in the drug supply, providing fentanyl test strips, expanding naloxone, right, which is used for reversing an overdose so that somebody doesn't die if they overdose. So there's really been a multi-pronged approach. And so it's, it's difficult to pinpoint one thing, but there's really been a tremendous investment and really using all of the tools that we have to address that overdose epidemic.
Great, thank you. So Eva, are you re-raising your hand? Because otherwise I would like to go to the other people who have questions.
Let other people speak first. I still have 2 more questions.
Yeah, okay. So I'm going to go to the members of the committee. There's a few questions. I just want to be clear that there is no ask. This is an informational presentation. There is no site in East Harlem on the table right now. This is an informational presentation because I'm seeing, comments, questions, et cetera. So I want to be very clear.
Don't do that.
There is no ask at this time. This is an informational presentation. And I think, I want to make sure that everybody stays on message with that. So I am going to take Joseph Benedetto. I see your hand is up, Joseph.
Oh, yeah, I had a question for the doctor. In terms of the naloxone trainings, I've been hearing mixed things regarding the training, meaning if there's a certain time where you have to recertify, sort of like CPR.
Oh,
Joseph, I think we
Different things.
lost you. Yeah. There was a question you said about recertification. Is that correct?
Yeah, yes. Should I repeat? My connection's not that good.
Yeah, if you could.
Yeah, I just wanted to know if the naloxone training ever expires or if that's something that has to be recertified similar to CPR, because I've been hearing mixed things.
No, there's no expiration for the training. However, there is expiration on the medication. So that's really the bigger issue. And so just making sure that, that people have the naloxone medication that is not expired, so that when or if you have to use it, that it'll be effective.
Okay.
Great. I'm going to call on, it looks like, I believe it's Jane Murphy is the other person whose hand is up. Miss Murphy, do you have a question for Dr. Cunningham?
I do. Thank you so much for calling on me. And I want to thank Dr. Cunningham for the wonderful work that she's doing for our city. I think it's really important work. I'm a proud and happy resident of East Harlem, and I was interested to hear what Eva Chan was saying about the seeding of more methadone clinics in East Harlem. And I want to honor what you said about, Chairwoman, about not having a seat identified yet. But I just want to emphasize that East Harlem currently supports a lot of methadone clinics, and about 24% of the clients at the methadone clinics that we currently are supporting are actually residents of East Harlem. So I'm not sure where all the numbers are coming from with the number 1 or number 5, but as far as the numbers of who actually needs the services, I think that what's happening is we're seeding a lot of services in East Harlem that don't necessarily serve the population here. So I just want to put that on the record.
Thank you. I just want to know if there's a question. I appreciate the comment, but just in the essence of time, is there a question that you also have? Or
no,
it was just a
thank
comment?
you so much.
Just a comment. Thank you so much for sharing that. I appreciate that. No, thank you. I'm going to go one back around to Eva. I'm sorry, Dr. Cunningham.
Yeah, if you don't mind, I'd just like to comment. So I think there has been some confusion about, or questions about the overdose data. And so the way that the health department categorizes overdose data is by the person who dies where they reside. So those data that we said were in 2019, that East Harlem had the 5th highest overdose rate, is those individuals are people who reside in a zip code in East Harlem. They're not from the outside. And so that's how our data are collected in terms of overdose deaths.
Thank you for the clarification. Eva, opening it up just for questions, not comments, to stay on schedule because we have to get to the budget. So do you have 2 more questions, you said?
Yes, I do. First question is, when we calculate the overdose rate, do we account for residents from the homeless shelters in East Harlem as part of it? And also, is it their original residents that you track, or?
It's their existing residents, the zip code that is used. And what we do know is of those deaths among residents of East Harlem, the majority are not from Wards Island.
Was there a second question, Eva, or did you roll them into one?
The second one is about whether the overdose data it's not distributed by community board district. I think it's by health district. Is it possible to obtain the data that is by community board district, so then the data will be more easily comparable?
Yeah, so I can't speak to that level of detail, but I certainly, you know, we could go back and get back to you to see if that's possible.
I appreciate that. Yes, if there's a way that, yeah, if you could make an ask to see if that was possible, that would be helpful for us as we move forward. So I don't see any other, oh, Marlene, I'm sorry, your hand's raised.
Yes, thank you, Nye. Thank you so much, Dr. Cunningham. Are you able to send me the presentation and I'll give it to the members of the committee? If you are, and I understand, but I'm just asking just so they can have it after this meeting.
Thank you. I will check with my colleagues and get back to you about that.
Okay, thanks so much.
Absolutely.
Great, thank you. So I'm going to close out this section and move on. Thank you, Dr. Cunningham. If you could please drop your information into the chat. I know this topic is very timely here in our community as we seek to make sure we provide services to those who are in need while balancing the placements of ongoing services. So thank you so much for sharing with us this evening.
Thank you.
All righty, so we're going to go to the meat of the meeting. I know it's almost 7 o'clock, guys, but this is really the heart of what we need to accomplish for tonight, which is a review of the fiscal year 2023 budget requests and recommendations. We technically slotted this for 20 minutes, but this is really to allow a presentation of the items that are rollover from previous years, recommendations for new items to be reviewed or considered, and then to have a discussion and make modifications because the committee is meeting on Thursday. So we are in a very tight timeline to get through this evening. I see that, sorry, there's a buzzer noise. I see that our Vice Chair, Xavier Santiago, has his hands up. I'm going to turn it over to Xavier. And Xavier, when you're done, if you don't mind turning it over to Marlene, who will lead us through this process.
Yes, sorry, I'm still struggling with dinner with the youngest. I saw Diana Ayala was on, who was invited to come attend this committee based on last full board. It looks like she's signed off now, but I just wanted to call attention that she did show
Xavier,
up as committed.
It said that it was Maggie. I did see that, but it said that it was Maggie.
Oh, it was? It just said Diana Ayala. Okay.
Yeah,
Copy that.
I
Thank
did
you. I'll
read
let
that.
you carry on.
Yeah,
It showed up as her handle.
Yeah,
All right,
thank you. No, I did notice that, but it did say that it was Maggie just dropping in her information, and I didn't see anything else to update.
Copy that. Thank you very much. I'll let you carry on. Apologies for the interruption.
No worries. Thank you. Always great to have you on with us. Marlene, can I please turn the floor over to you to walk us through this important section of our agenda for the evening?
Sure, of course. Thank you, Nye. Again, good evening to the Committee for the Human Services Committee and also to the public. This is just an extension of the budget conversation that happened last month in September. Last month, the committee reviewed in depth the public input survey that was held over the summer. And the committee reviewed the responses from the from Community District 11 that were sent in via hard copy and on the computer. So that those inputs were supposed to be vetted and reviewed by the committee, which they did. So just for new members of the committee, the budget process can be, it's a thorough one, but there are steps. There are 4 parts to the budget process on a city level. The first step is that the mayor has to create what is called preliminary budgets. And so the public responses from the public input survey and the recommendations that comes out of this meeting and eventually what is sent to OMB no later than 10/29 is what helps the mayor and the city council, develop a preliminary budget. And that preliminary budget is vetted and reviewed. And in April, the mayor comes up with what is called an executive budget, and many hearings happen throughout that process. And then finally, all of this work that you are all doing from September to April. It's what leads to what is called the adopted budget for the city. The mayor and the city council eventually adopts the mayor's budget plan for whatever fiscal year we're in. So right now we're operating in fiscal year 2022, but all of that work was done in 21. And the budget, for those of you that don't know, the budget runs from July 1st to June 30th. So right now, with that, all that explanation, if all of you are still wondering if you would like to read it, I could send you a quick synopsis, just a link so you all can read it. But your role right now as board members is to create budget requests that will then go to the office of, when I just said the acronym, so it's the Office of Management and Budget and the Department of City Planning, so DCP. And Community Board 11 will send some requests that they would like. There are existing requests. Your committee member, Eva Chan, created some new requests prior to this meeting, and those will be, if you all agree with her suggestion, it will be added to the budget tracker at the end. But right now, let's go over the existing things. So just give me a second to pull up the tracker and for your specific committee.
And I just want to add that if anybody does have comments and or questions, all of the changes will be fielded through Marlene. So I know that there was a document that was shared with the committee members and the board members. Please do not make any edits inside that document. If you have a recommendation, if you see a typo, if you think something should be reworded, please send those comments directly to Marlene with a copy to me. And the district office staff will be coordinating the editing process to make sure that we have a succinct document and are ready for our district needs and budget meeting.
Right. Thank you for that, Naya. I forgot to add that. Just to avoid any level of confusion. So we want your input to be added correctly. So I have agreed to do the typing, which I'm more than happy to do. And we can do that on the floor tonight, if you all are prepared to do so. So if you're ready, we can go into the existing request from last year. So if you see the column all the way to the left where it says new FY fiscal year 2023 tracking code, it has not been created yet. So that's why that column is blank. So as I described earlier, the budget cycle is from July 1st to June 30th. The adopted budget cycle, I'm sorry, just to be more clear, is from July 1st to June 30th. And right now you are operating in fiscal year 2022. That's why these tracking codes already exist. But the requests were sent in 21. So the budget year always is forecasted to the next year. So right, that's why we're about to be in 22, but we're forecasting for 23. So Mai, if you're ready, I don't mind you reading it.
I'm on my phone, so I don't know that I'm going to be able to see this because it's a little tiny. So if you don't mind reading it, and then I'm happy to chime in.
Okay. So just to move over, let me minimize my screen with your faces. Just to move over. So here's what we're doing tonight. Well, what you all are doing tonight. So this was where it says fiscal year 2022 adopted budget, and it says AGY. That's just an abbreviation for the agency response. And then the staff recommendation was to remove and move this to an expense, because right now it's under a capital budget request. And so you all can choose to leave it where it is. But your committee recommendation would be either of these. So remove, revise, or add. So that's completely up to the committee because you all have to agree.
So let me just ask a clarification on this, because I do remember our robust discussion about this last year. So it definitely does not seem like a capital expense. I mean, yeah, it seems more of a budget expense. However, it's been given a tracking code, and I'm just looking at the agency comments that it's not eligible for capital, but do we know if they agreed that it was something worth having? Because I know we're going to move it, but was there conversation on whether or not that was something that was in consideration as an expense before we move it?
Right, so it is, needle pickup is always like during the district budget consultations, this always comes up.
Yeah, it's been there for a long time.
Right,
Yeah.
and it should stay.
Yeah. So we're just moving it from a
We're just
capital
moving
expense to a
right.
budget expense.
Right.
So I'm going to put that up on the floor for the committee. This one seems like a very simple one. To keep it on the budget, it is something that is continuously in need. And I know that Councilmember Ayala has stepped up a lot of outreach to start with cleaning it up on her own, and community members have been coming out. But you know, we definitely need more support. And I know that Parks and Recreation has also talked about this. And so do we need to vote on a move, Marlene? No. Okay.
No.
So
Yes.
I'm going to just open it up the floor to the committee members. This seems like a very simple, it says remove, but actually we're moving it from the capital expense to a budget expense area.
Right.
So
Yeah. So remove from the, like, you see this like this black bar just like separates the capital and expense. So you're just moving positions. That's
to
it.
a different, yeah, just to a different category. Any questions from members of the committee before we follow the staff recommendation to move it into the appropriate budget area? So I'm opening it to committee members first. Marlene, can you see if, I see that there's some hands raised to identify if
I
it's a
don't see any
committee.
hands raised from the committee. I
don't either. I see a
public,
general
yeah.
public, but I'm not opening it to the public yet. I just am checking with the committee first.
Mhm.
Okay. I see Pastor Scott is saying, sounds good. Is there anyone who objects on the committee? Sorry, we have some children playing in our hallway that are causing all sorts of ruckus tonight. Okay, I don't see any objections from any of the committee members. So Marlene, I'm going to ask that you please move this item from a capital expense to a budget expense.
Right.
And
It
I
can
don't see-
stay where it is.
Right.
Right. So it could stay here and just has to be noted that where
It goes in the right category.
that it's good. You agree to remove it.
Yeah, we agree to move it to the right funding category. Okay, next item, Marlene, please.
So the next one. Sorry. Okay, so the next one. See if I can move it over. It's an expense and it's to DOHMH and it's to create the needs category, create or promote programs to destigmatize mental health problems and encourage treatment. Also, I forgot to mention this. So the needs category will always come from the budget reference guide. It's not the office or the committee, it's not creating this language. OMB has this very particular, way that they populate the needs from each community board. So you have to make sure that you're pulling it from their language. So when they put it, input your information from a specific community board, that it's sound, that it matches up. Just for the new members of this committee, if you're wondering where that language is coming from. So the reasoning also will come from the committee members, just so that's clear. And the reasoning was, this is an existing one. CB11 ranks first in the city for psychiatric hospitalizations, 2016 per 100,000 adults. Funding from the new Thrive NYC initiative should be targeted to improve programming in East Harlem. Supportive programs should be developed and better targeted to particular populations to encourage people to reach out and get help before needing hospitalization so that their mental health needs can be positively managed. Programs should annually assess and evaluate to provide assistance with jobs, housing, education, medical issues, and any other needs that this vulnerable population may have. This went to city agency, DOH, and the Department of Health and Mental Hygiene, DOHMH. And this was the agency's response. OMB supports the agency's position as follows. DOHMH funds a variety of services related to mental health, alcohol, drug abuse, and depression. We will review and assess the request for additional programming, which would be contingent upon available resources. So the office suggested to revise it slightly, excuse me, and this is the revision. I don't know if you all had a chance to read it before the meeting, but we could read it now. The rate of adult psychiatric hospitalization in Harlem is nearly triple the citywide rate. So this changed. And that data, the change in data came from the Department of City Planning, New York City Community Profile, that if you're wondering where that number is coming from. Funding should be targeted to improve programming in East Harlem. Supportive programs should be developed and better targeted to particular populations to encourage people to reach out and get help before needing hospitalization so that their mental health needs can be positively managed. Let's put this down. Programs should annually assess and evaluate to provide assistance with jobs. Sorry, this keeps flipping.
Yes, it's kind of tricky looking at a Excel sheet.
It's just the screen it's small. That's what it is.
Yeah. Okay. I find sometimes if I put the actual tab in the field, it's a little easier.
Okay.
Yep.
Thank you. For evaluate to provide assistance with jobs, housing, education, medical issues, and any other needs that this vulnerable population may have. The language was just tweaked. The data above was changed to be reflecting of this current year. Actually, it's reflected up until 2018. After 2018, they haven't updated this data.
Okay. So a couple things that
yes. Mm-hmm.
I was just going to say, I know that this item is a carryover from last year.
Yes, it is.
Sorry, the more the kids come by my door, it's going to keep setting off the alarm, so forgive me. This is the recommendation coming from the staff, correct? To tweak the description and revise it to fit this new wording, correct?
Yes.
Okay. So I'm going to open it up for the committee members. I saw that Eva's hand was raised. If there are any questions about this item and whether or not we accept the staff's recommendation to revise the language. Also, we knew when we spoke about this before that we would have to make adjustments post-COVID for whatever impact that would have on the mental health well-being of our community board residents. And so I think this new language does reflect that. So Eva, did you have a question?
Yeah, I agree. My main question was whether we still have the Strive initiative. It seems that the staff took it away, which I think is good. So we can just be more generic and let the expert decide what is needed.
Yeah, I would agree also because we're going to have a change of leadership. So who's to say whether or not it'll still be called that particular program or if that program will exist. So I think it's important, I agree, to be more all-encompassing. Are there any other community board members or committee members with a question or comment? Okay, seeing none, I'm going to go ahead and ask, are there any objections to us accepting the staff's recommendation to revise the language? If you have an objection from a member of the Human Services Committee, please raise your hand. Okay, seeing none, Marlene, we are going, it looks like the committee's agreeing with the revision that the staff has recommended.
Okay. Okay, the next one is from DIFTA. Okay, so the next expense budget request, enhanced home care services. Funding is needed to expand services to our multicultural community of low income and below federal poverty level seniors. This is from the Department for the Aging, DIFTA. And the agency's response was OMB supports the agency's position as follows. More information is needed from the community board before making a funding decision. The community board should contact the agency. The staff suggested to revise this request. Funding is needed to expand home care services for low-income seniors.
I want to open this up because I do remember, Robin, there was lots of conversations we had before about the specific type of service that we were interested in getting for the seniors. Robin, I don't know if you could refresh our memory if we needed to tweak the staff's recommendation further to make sure we address that specific item. And I don't remember what it was called, but I know that Robin knew what it was called.
Thank you. I do. And I don't remember if it's further down below this line.
That's what I was checking. It might be in another one. I don't know if it's in this one.
Yeah, it might be another one, but the program is called ISEP, EISEP. There was always a waiting list. It is a funded home care program. There was not enough money in it. That's why I'm always asking for more, because seniors are on waiting lists to receive home care for that program.
Right. Okay, so there are a few from.
I know there are a few, but I can't see them all.
Yeah, so, well, let me know if you can't see, because there's 3. Can you see in column E, there's 1, 2, 3 for DIFTA? Are you able to?
I do see provide for the caseworkers.
Okay.
Those are different. Those are not about home care. One's about caseworkers and the other one's about faster service for transition from rehab to home.
Yeah.
They're
So
not
I
together.
think, yeah, I think that service that Robin mentioned, I believe belongs in this category, Robin, because I remember
it does.
the robust conversation.
Yes.
So I'd like to recommend that we accept the staff's revised language and amend it to and specifically mention this service. So Robin, do you want to, if you don't mind, like give language to Marlene that she can insert here? So funding is needed to expand home care services for low-income seniors, including support for, or I don't, however you would like to word it.
Specifically for the ISEP program, EISEP. I forget what it stands for.
Which currently has a waiting list, right?
Yeah, historically, there's a waiting list. You may add that.
I think that's important to say, which historically has been underfunded and has had.
Robin, you mind saying that acronym one more time, please? Robin?
Okay, E as in Edward, I as in income, S as in sugar, E as in Edward, P as in program. The ISEP program, which historically has a waiting list due to being underfunded.
Thank you.
You're very welcome. Thank you.
Eva, I see your hand is raised. Is it related to this item?
Yes. It's related to supporting seniors, both homebound seniors and in senior centers. I also just want to corroborate Robin to say that it seems that funding has been cut and there's not enough caseworker, not enough in-home work visit workers, especially for seniors who don't speak English. They have a challenge of a person coming into their home and they really cannot communicate. That's another additional layer of problem.
I believe we used to have an item that carried over because I believe Xavier was the one who worked with us on it about language and culturally appropriate caseworkers. So I'm going to pause on that for a moment till we get to the caseworker item, if that's okay. Are there any objections from the committee members to the language? So A, to the staff's recommendation and B, to the adjusted language or amended language that we've submitted. Are there any objections? Okay. Seeing none, Marlene, do you need anything else from us on that item, or can we move to the next one?
No, you can move on.
Great, thank you.
Sure. The next expense item, other animal and pest control request, provide funding for proactive measures to mitigate.
Can I make a suggestion? I'm so sorry, Marlene, to interrupt you. Could we do the other senior ones for DFTA and then come back to the pest control one, just so that we stay on topic?
Sure, no problem.
Thank you. So we're just going to
Sure.
skip down to the next item.
Okay. Ready?
Yes.
Okay. Increase case management capacity, provide funding for more caseworkers. This went to the Department for the Aging. Their response was further study by the agency if this request is needed. Therefore, OMB does not take any position. The staff's recommendation was to remove and put this in the statement of district needs.
So this is a tricky one, team. So they're saying that they need more data and more information. I feel like the census could be helpful here. The staff is recommending that we remove this and add this to the district needs. However, I know we had a robust conversation a year ago about the need for more culturally appropriate case workers. So workers that spoke various languages, represented different faiths, and diverse communities. So I want to put it out to the committee members, whether or not you want to remove this and put this in the district needs. Do you want to continue to have this as a line item? So I want to open it up for the committee members to please raise their hand for comment. I see Eve is up. I also didn't know if Robin or anyone else who works with our senior populations would like to make a comment as well. Eva, the floor is yours.
I mean, like I said earlier, I went to ask the centers that support Asian seniors, and mainly actually seniors, not just Asian seniors, but so Union Settlement and Carter Burden Center, and they both have heavy workload, especially Carter Burden Center's budget has been cut. They actually had to reduce one or two caseworker, at least one Asian language speaking worker, and it really slows down the speed by which they can respond to any inquiry. So I think it would be better to keep it on here. And it's also surprising to say the further study of agency requests is needed. And maybe what can we do to supply the information? Because I think the need is very clear. The reduction in funding is also clear.
I also think that we have, yeah, I'm still here.
Yeah, I just want to say, in the recommendation column where it says this request has been funded, it's because of the borough budget consultations. DOHMH has addressed the caseworker need. So that's why the staff recommended to remove this budget request. The need for additional caseworkers is being addressed. And maybe in the statement for district needs, maybe you all can push for the translation piece, but it is being addressed.
Okay, I'm just going to open it up for Robin. You had your hand raised. I just want to, and I'll circle back, Marlene, because I want to better understand what it means that it's being addressed. But Robin, could you please comment?
And here's the real issue here. The Department of the Aging has not increased their budget in quite some time. I mean, I think it's a question of having, the three monkeys like this, right? So we're never going to be able to win this one, because how do you prove to them that there are not enough workers in these DFTA funded senior center programs? It's almost like you're not going to win this one. I think that if you go about it and say perhaps to increase more culturally appropriate workers in our community, specifically Asian speakers, that you may have a better chance of. But it's almost just too generic the way that it is.
Okay, thank you for that.
You're very welcome.
Xavier, I know this is something that was near and dear to your heart, so I'm going to recognize you.
Yeah, thank you very much. I think in general with the funding process, we had to, sorry, the dogs, all of my bipeds and quadrupeds are very active this evening. The specificity is helpful, and I think it's fine if we send this over if it's been funded, but I think the follow-up, and this is the importance of district consultations, which happened during the summer months, is we have to follow up and chase these things down and have more specific policy questions answered. And this, if we are going to shift it to district needs and budget, I think the specifics we need to ask are, if the budget isn't changing, how much is being appropriated for multilingual staff and caseworkers? And I think that specific ask is something that will be easier in answering. At this time, I do think there remains a dearth of multilingual caseworkers throughout all agencies, but this is one that is most crucial to our community. And I think the lack of a specific ask is, we're just saying we need more caseworkers. Okay, great, we'll do that. Done. It starts turning into a Ricky Gervais comedy bit. And it's really, we need to say, we need specifically more Spanish speaking and Chinese, open parentheses, Mandarin and Cantonese, close parentheses, speakers. Or if we have more Portuguese for Brazilian immigrants, that's specific requests will get us more traction with the engagement. So that's all.
Thank you. So I'm going to ask the committee. So Robin, your thought was, let's move it to district needs because we're probably not going to win this, but be more specific. Eva's point was we should leave it on because it continues to be needed. My curiosity is back to Marlene's statement. So Marlene, you said it was going to be funded. I do know also the COVID mandates for vaccination have changed staffing levels across all various interactions with our senior and healthcare or those who need health access populations. But I also know that we have heard from our local groups, from the Stanley Isaacs, from the union settlements, from others, that they can always use more staff because the request for services is often greater. The demand for services is often greater than they can deliver. And I know that they are amazing at trying to meet all of those requests. So Marlene, when you say it's being funded, is it being funded somewhere else?
Yes, so not yes to your answer. So I'm not sure if you all saw that I sent out the borough budget consultations for district for you guys to read. So it doesn't state specifically because it's the borough. It doesn't state specifically East Harlem.
That's what I thought. Okay.
I'm looking for that detail. I could bring it back to the office because the borough budgets do focus on Manhattan as a whole. Also, in Manhattan, they reported to the community boards that caseworkers have been increased, and since the onset of the pandemic, those workers have increased. Have they specifically increased caseworkers that are, knowledgeable of other languages besides English? That wasn't clear. So you all can choose to keep this if you would like on the budget tracker and not remove it and put it in the statement of district needs. Or you can also keep it and put it in the statement of district needs.
Yes.
You do that. Yeah.
I would like to recommend to the committee that we do both, that we leave it on and also reiterate that need, because I am curious to know what the increase has been specifically in CB11, not just Manhattan wide. And again, to address the cultural competency, language competency, faith-based competency, et cetera, issues. Eva?
Yes, and I think it may be worth having two items. One is caseworker for just senior in general, because at least from Carter Burden Center, I know the budget has been cut in general. And then for any more culturally sensitive support, it may be a separate item. Which is actually one that I am proposing to add.
let's finish with the one we have, and then we can look at the other items.
I agree, meaning that I think maybe keep this as not culturally specific and just to increase caseworker, because I do think regardless of what culture, there is lack of caseworkers anyway.
So you all don't want to, what I'm writing on the far right is what's going to be
Robin,
submitted to
can
the office.
Robin's shaking her head. So Robin, I see you.
I just don't understand if we think this is being, I'm confused. Do we think that this line is being funded? Provide more funding for more caseworkers?
So our understanding is that there is a line of funding coming out to increase caseworkers for Manhattan, the borough. It does not have the drill down of how that impacts our district of CB11.
And it's specifically from the DIFTA funding line. Okay, then I think that's your answer then.
So I think that we should do both. We should leave it on, would be my recommendation, and also mention it in the statement of district needs, because the data doesn't give us information as to how that money is going to support the needs of the CB11 residents. And again, doesn't address then the cultural competency component of it. So Marlene's recommendation is to do both. I think that that's a good recommendation. I'd like to pose it to the committee members. Are there any objections to doing both, leaving it on and elevating it as part of the kind of opening summary text of our statement of district needs? Any objections from the committee members? No. Okay. So Marlene, that's what we're going to do to handle that item.
Okay. So I need to know on the far right, what I wrote in is that, are you guys just adding this, meaning just keeping it as is, or are you revising it to reflect the language? You all mentioned culture.
So, yeah, I don't think we should, I don't know that it's Portuguese or, Mandarin. I think that
I was just jotting down as Xavier was
no, I know you
speaking.
were, I heard, Brother Xavier freestyle rapping and I saw you typing. I also think, and again, I don't know if this is possible, but can't we use census data to reflect what the needs are of the community? I feel like there's robust, I know the Borough President's Office is doing a whole training on how our community boards can use census data to evaluate what the different diverse ethnic groups are here, and then provide services accordingly. So
are you able to, are any of the members of this committee able to give me census data by tomorrow?
Yeah, Eva, can I ask
I've seen the census data. I mean, it hasn't really changed, right? So
yeah, I think we should just pick the top four languages that we need, because of course, I feel like French Creole is also important. We have an aging African population also in the district. And so I think that might also be important. So Eva, I'm just gonna ask, and knowing you're so fast, you might do it while we're on this call. But there was a last district report from the mayor's office of the top languages here. If there's a way to just quickly identify them, and we can give it to Marlene so that we can close it out for tonight, because I know this is due tomorrow. Thank you. So we're gonna do both. There was no objections. Marlene. I believe that we have two hands up. So I don't know if they were from previous Eva, and then I see Michael Lopez, who's one of the members of the public. Eva, did you have a question, or was it just what you were saying about there's something coming up later?
No, my question is, or my statement is, I think the senior center measure whether they have enough caseworkers by the number of days before they can respond to each senior. So that maybe is a good statistic to cite. And I heard something along the line of, the next day going into 3 days. So we can maybe collect some of these statistics. I mean, I don't think we'll get it by tomorrow.
Yeah. I think that because it says it's being funded under a different line item, I think we need to stick to how does that funding trickle into this particular community, and ask that question, and then B, stick to the cultural competency stuff, because again, if they're saying it's already being funded, then I don't know that we need to dig too much further in the weeds on that. We just need to know how that funding is going to be allocated to our community. Mr. Lopez, Michael Lopez, is it? Did you have a question? Because otherwise I want to make sure the committee gets back through this.
Yes, I
Mr.
have a
Lopez?
question. No, when maybe a statement.
I'm going to
yeah,
ask you to
maybe
keep the statement brief then, because we have a lot
Yeah,
of
they're
items
very
to
brief.
get through. Sure.
I just want to make sure that when we speak of cultural competency, it's just not the language. Like I learned French so I can be a French caseworker. No, cultural competency includes more than just knowing
That's
the
why I'm
language.
using that term and not just language. I'm using
Okay.
cultural competency. Our board last cycle picked that term on purpose because we know that that could mean, you know, someone who's of the Muslim faith serving a senior who's of the Muslim faith and knowing their dietary and other restrictions based on that,
Okay.
or if someone's Jewish, et cetera. You know, so we're using cultural competency in a larger setting, but yes, we mean it to include language, culture, and other norms, and having a sensitivity and a knowledge and appreciation to be able to better serve that senior population.
I like the definition and your usage. I just hope that those that read it see it that way, or also those that are in the position to implement something also see it
And
that
we
way.
can
That's
expand
why.
and clarify when we do our district needs statement, so we can work on that.
Okay.
Thank you so much, Mr.
Okay.
Lopez.
All righty.
Thanks. Marlene, I'm going to turn it back over to you.
Yes, okay, so what I need from this committee, because I'm tasked with going back to the office. So I need from this committee a clear sentence. Right now, this is just like a jotting of ideas.
Right.
It's a clear sentence. So before we leave, Eva, are you as a committee telling Eva to create the sentence that you want to?
I was just asking Eva to
with that?
quickly, if she could look up to identify what the 4 key languages are for the community. I believe that they are Spanish, either a Mandarin or a Cantonese, a French or Creole, and I believe that there is one more. So I'm just curious if there is a 4th that I see normally when materials coming into the community are translated.
Right, I understand that. So you see the first.
So this request has been funded. What add to statement of district needs? And then in terms of our modification, the specific request is to increase the number of culturally competent caseworkers in CD11.
I got it. You can keep going. Workers in CD11.
Right. Specifically those who are able to provide services in, and then I think we were going to pick these 4 languages. So Spanish, French/Creole is usually kind of one and the same. I think we should do Mandarin/Cantonese, 1, 2, 3. And I think that there is a 4th. I'm just trying to figure out, and I'm actually also looking on my phone here, what the 4th one is.
Yeah, do you not want the position?
So I would do Mandarin/Cantonese, French/Creole.
Okay, and that's how you want, and then Eva's gonna come up with data? Yes?
Yeah, the last language, the 4th language.
Yeah, just whatever the 4th language was is all we were looking for.
I'm sorry?
We were just looking to see if there was another language that we should specifically identify.
Oh, I see. Okay.
That was it, because I believe that there are 4 top languages. So it says Spanish, Chinese, which includes Mandarin and Cantonese, French, which includes Cajun and Creole. And then I'm just trying to read this from the data here. And I don't see a 4th yet. So I'll just keep looking, and I'll put it in I'll text it to you, Marlene, what the 4th one is. But I believe there are 4 key languages spoken here.
All right. So is Eva still looking up census data? No?
No, I think this will be
Okay.
fine.
That's fine. I just want to make sure I'm truly reflecting what you all want. So I'm
Yep.
sorry to interrupt.
No, it's okay. Increase the number of culturally sorry, can you open that up one more time? I just want to make sure it's okay. Culturally complex caseworkers in CB11, specifically those who are able to provide services in Spanish, Mandarin, Cantonese, French, Creole. I believe there's one other language.
You'll look for it.
Yep. Okay. I think we're okay to move to the next one. Because I'm looking at the census data right now.
Okay. Now the next one is 23E. This is you said just move to the DIFTA, right?
Yeah, we were going to mention in the
Okay.
statement of and list. So we were going to do both.
So this next, you're right.
Okay.
The next, you just want to stay with DIFTA for now. Don't like jump around, right?
Right. Yeah.
Okay. So the next DIFTA budget request is allocate funds for outreach services to homebound older adults and for programs that allow the elderly to age in place. Provide funding to ensure faster service for seniors transitioning from hospital/rehab to home. The Department for the Aging. The response was further study by the agency of this request is needed. Therefore, OMB does not take any position. The office suggested to keep this as a request, and you all can, discuss it.
So we're keeping it. I don't understand when they say further studies needed. I feel like that's such a weird response. I think that it should remain. I'd like to open it up to members of the committee to comment. Oh yeah, so Eva, I'm looking at this Puma as well. I'm also looking at the Furman Center. The Furman Center has an East Harlem report profile from 2019 that I think is also good.
I think this one just has the specificity,
right?
That is basically African language. It's just marginally higher than. And
So
then you have
these,
a lot of like Japanese, Russian, Korean.
Yeah, I feel like the other one is Russian that I'm thinking of, but.
Bengali is higher. So West African and then Bengali.
All right, if you could just drop it into the chat for Marlene to pick up whatever the next one or two languages are that we should accommodate, or specifically.
I'm sorry, I'm sorry to interrupt you. I'm too focused on making sure this grid stays together. So if Eva can just raise her hand when she finds it, if that's fine with Nye, and we'll just go back to them.
Yeah, and we should go to the next one. So we're on the next item already. I did not see any objections or comments from the committee. So it looks like we're going to accept the staff's recommendation on the item.
Okay.
Next up.
23E. Just this one more DIFTA. I think that's all for DIFTA. See something? Is there's more. Okay, there's a few more DIFTAs in here. Yeah, we have two more DIFTA. Okay, so 27E, enhance home care services, provide funding to expand hours of home care provided to ensure fewer rehospitalizations. DIFTA, their response was further study by the agency if this request is needed. Therefore, OMB does not take any position. The staff suggested to revise this. And the revision reads as follows: provide funding for expanded in-home services for the elderly, including expanded hours of home care provided to ensure fewer rehospitalizations.
Marlene, do you mind just, actually I got it here. Provide funding for expanded in-home. Okay. So I'm going to open it to the committee on whether to accept the staff's recommendation or if the committee members have any other comments. I don't see any hands raised. Are there any objections to us accepting the staff's recommendation? Okay, I think this one stands. Many of these DIFTA ones, you know, we had a robust conversation about last cycle. Next one, Marlene.
So we're agreeing to revise it. Okay. Just one more DIFTA, right? There's the next DIFTA. Okay, so 42E, enhanced home care services. Provide more funding for expanded in-home services for the elderly and hours of home care. Further study by the agency of this request is needed. Therefore, OMB does not take any position. The staff's recommendation was to remove and combine with expense item 27. So
Okay.
Yeah.
Yep. So I think that that's a great recommendation. I'd like to pose to the committee members that we accept the staff's recommendation because some of these are duplicative. So I'm going to first ask, are there any objections to accepting the staff's recommendation of combining this item with the previous item? And if so, could the committee members please raise your hand? Okay. Seeing no objection, Marlene, I think we should move forward with the staff's recommendation and combine it with number 27.
Okay. This looks like the last DIFTA.
Okay.
43E, enhanced home care services. Provide funding to hire more Spanish-speaking home care workers to serve the East Harlem community. The agency's response, further study by the agency of this request is needed. Therefore, OMB does not take any position. The staff recommended to keep this budget request.
So now let me ask you this, Marlene, because I feel like we added kind of part of this to the other one, except the other one is lengthier and includes multiple languages. This one is specific to just Spanish. Would there, knowing, you know, the staff didn't see that we've done this combination, would it be possible to combine this to the other one, the same way we just combined with the E27, like combining this with the previous item where we added the staff, or should we revise this one to include the cultural competency part?
This one, let me see. Provide
because we added the language to the previous item. And I'm saying maybe we should have, because we hadn't gotten to this one yet. Maybe we should build out, this one to address the cultural competency.
I hear your question, but I'm just trying to see if there's a, difference between home care workers and caseworkers.
Oh, let's leave it then.
Let's specifically speaks to caseworkers.
Yep, let's leave it because they are two different things.
Okay, so you want to.
So I'd like to recommend to the committee that we do add it. I see Eva's hands raised. And if there's any other committee members with questions or comments about this item, please go ahead and raise your hand so that I can get the queue going. Eva, the floor is yours.
I would just add Chinese to Spanish.
You would add, oh, I see. Provide funding to hire more
Spanish and Chinese.
Okay, does the committee agree?
Does any member of the committee object to revising it to include Chinese in addition to Spanish? I don't see any hands raised in objection. So we're going to move forward with adding it and modifying it to include Chinese.
Now, let's see, before the diff started.
So then I think we're going back up to the pest control item.
Yep. Okay, so let me just see something. Okay. This one, other animal and pest control, this is budget request 20E. request, other animal and pest control requests. Provide funding for proactive measures to mitigate rodent populations in public housing, empty lots, construction areas, and train stations where rats establish colonies. This is from the Department of Health and Mental Hygiene, DOHMH. Their response was, the funding for this request cannot be determined at this time. The staff recommended to add this, keep it.
Yeah, so I don't know why the funding cannot be determined at this time, considering it is something that is on everybody's mind in Harlem, river to river, because of all of the construction going on. The recommendation of the staff seems sound. So I'd like to open it up to the committee. If there are any members of the committee who object to the staff's recommendation to add this and keep it on as an important line item for the budget, if you could please raise your hand if you are a committee member. Seeing none, Marlene, I think we move forward with the staff's recommendation.
Okay.
Great. Next up.
Okay. I think the next one is 26E.
Oh, excuse me.
Okay.
We have the longest list.
I'm sorry?
We have the longest list.
Oh, no, it's important work though.
I know. No, that's why we are working hard.
Mm-hmm.
Our committee is so inclusive of so many different layers. So.
Right, this committee is all encompassing of what is human services. So you're in a lot of different agencies. So this one, 26E, provide more HIV/AIDS information and services. East Harlem residents are more than 3 times as likely to die from HIV/AIDS as the average NYC resident. Sex education services should be provided, especially among vulnerable populations, and access to HIV preventative drugs should be easy and affordable to all. This request went to the Department of Health and Mental Hygiene. Their response was the funding for this request cannot be determined at this time. Okay, so the staff, this should be here, recommended to revise this. And the revision reads as follows: HIV/AIDS continues to be one of the leading infectious diseases in East Harlem. Funding for pertinent sex education and access to HIV preventive drugs should be made available to vulnerable populations. You all can discuss. You're on mute, Nye.
Is Xavier still with us? Because I know that this is an item that he also.
He's still
Xavier,
here.
I don't know if you have any comments for this item.
I thank you, Nye. Sorry, I was having difficulty unmuting. Zoom lifestyle. So I think revising it is fine. I do think we've faced many issues, and one that has plagued us as much as COVID, if not more, for the longer haul, has been HIV/AIDS. It took my uncle. It's taken many members, family and friends of this community in Northern Manhattan and all throughout New York City. So how we address rephrasing this, I am a bit perplexed, because in the past, they've typically worked with us, whether it's seniors or high school age students. So I am open to the recommendation placed in the final column, and we see where it goes. But I think the bigger thing is our advocacy with the agency. That's where we have to push hard. And given the fact that currently people are the needle exchange programs, and that we are substance abusers and users are allowed to shoot up openly in public. They're not actively pursuing clean needle exchanges to utilize, whether it's heroin or what have you. That's a problem, because that's going to allow this virus to promulgate. Excuse me. So I think that recommendation is fine. The bigger thing is we have to keep in mind the holistic approach to this epidemic. And when we've currently, and I want to use the word loosely when we say decriminalize, but we're not redirecting substance users, I would say. We're not redirecting them to the resources they need. I think we will see in the next 5 to 10 years an uptick, but I'm fine with this recommendation. I think we have to have a long-term strategy. So I'll stop pontificating.
Agreed. Thank you. But thank you. So to the committee, are there any objections with accepting the recommendation of the staff to keep it on as a line item budget request, and just with the necessary revisions? If you have an objection, please raise your hand if you're a committee member. Seeing none, Marlene, we can move on to the next item.
Okay. It's more wise. Okay, so the next item was a DIFTA item. Oh, the next one just DIFTAs. Okay. Let's see if we did everything. Revise, add, revise. Yeah, the next was DIFTA, which we did. DOHMH. Oh, this was the last one. I wasn't done. I'm sorry, it's out of order. So now on this tiny screen, I just have to figure this out.
It's okay, take your time. This is very complicated, so I appreciate you doing this to support us.
Right, you're very welcome. So the next one is request 34E, other park maintenance and safety requests. Explore alternative interventions for homelessness and substance abuse in parks, including Marcus Garvey Park and Randall's Island. For example, contracting local community-based organizations to station a trained mental health worker in Marcus Garvey Park to provide assistance when necessary. This went to the Department of Health and Mental Hygiene. The agency's response was OMB supports the agency's position as follows. The agency tries to accommodate the issue within existing resources.
And can I just double check, because I remember the conversation from last year. Does this sit with us, or does this sit with Parks and Rec, or does it, Parks and Open Spaces? Does it repeat on ours and theirs? How does that work?
Right, no, this was the one from it was the one from last year, but the reason it came to Human Services was it's specifically asking for trained mental health workers.
For the staff, it's the staff element of it.
Yeah,
Gotcha.
That's why it goes to Human Services.
Gotcha. So
Right.
What's the recommendation from the staff?
It should be to add.
Yeah. So I'd like to recommend to the committee members that we accept the recommendation of the staff. I'm opening it up for comment or question from the committee members. I'm recognizing Eva Chan.
Yeah, so I think relative to last year, now a lot of drug use is beyond just park. It's, in many streets. Should we expand this item to include more than just park and to include streets of East Harlem?
That's fine, but do you want to call out specific streets, or you just want to say streets in affected by drug use in Community District 11? It would be good to name streets though.
Yeah, I was gonna say, I also think that we've got to be careful, because remember, this came from parks and it was a specific park request. that it
Right.
came over as. So I
Right.
want to make sure, since it's been on and it's a rollover, and they're saying that they're going to accommodate it through current staffing, that we keep true to what the original request was.
Okay.
And we can then see, I know, Eva, you have some newer items if there's another place to expand, but this was specifically a combination of us and Parks and Rec. So I think that then it needs to stay within the Parks and Rec compound kind of context, especially because they're saying that they are going to do it within current staffing models. And those staffing models are probably assigned to Parks and Rec. So to the committee, any objections with any objections to accepting the staff's recommendation to add it and keep it for this year? If you have an objection, if you can please raise your hand. Eva, you're not objecting, correct?
No.
Okay. All right, Marlene, we're going to accept the staff's recommendation and move forward. And I thank everyone for their patience. I know it's getting late, but we are tight on deadlines. Sometimes that happens to our meetings because we are on Mondays, so we miss it when there's a holiday. I know it was Indigenous Peoples Day, / some people recognize Columbus Day. And so we are a little bit later in this month.
Okay, so you all are done reviewing the existing request.
Okay.
Eva added a few more, so I'm just going to, for the interest of time, I'm just going to pull up her, her grid. And then,
so let me just explain to everyone. So to the members of the committee and to the public that are on, we've just completed the review of the items that were previously on our budget as requests that have been reviewed with each agency over the summer, and of which we got their feedback as to whether or not it would be allocated, if it needed more research, if we needed a revision, et cetera. So that is the process that we just completed. Now we are going to segue into a few additional items that a member of our committee, Eva Chen, is going to would like to recommend we consider for adding. And so Marlene is going to pull up those items. And then Marlene, do you want to walk us through it? Do you want Eva to walk us through it? What's the best way to address these newer items?
oh, Eva could definitely walk you through it since they're her requests. Eva did a really good job actually at the budget reference guide and using the exact need language from the guide. So that's pretty clear. But I'm just going to share this. This is very tiny. So let me see if I share it. It'll help it become bigger.
So Eva, you're up next.
It's so tiny. Hold on, let me see. Okay. Because I can't even read it, so I'm sitting in front of it. I just
Eva, you might have to read it. I mean, I'm trying to make it pretty big on mine too, on my phone.
Got it.
It's
missing one item.
Okay, I'm sorry.
Is the healthcare facility the first one?
H+H, yeah, that's what I'm seeing as the first one. Is that not the one you want up? Let me check. Hold on, let me stop.
There's two more on top.
Okay, hold on.
So I'll start reading. The first
Wait,
one is.
hold on. I just want the committee to see what you're reading so they can like properly weigh in.
Got it. Sorry, everyone. I know I'm keeping people late. I'm sorry.
Okay, so this is the one. It's titled 2021-1018 underscore B2. DOHMA should be the first one, right, Eva?
Yes.
Okay. All right, let's see if this is. Was that big enough?
Yes. Yeah, so the first one is to increase program to address other public health issues. More peer support outreach workers and social workers on the street of Harlem are needed to provide information and support for people suffering from drug addiction issues. In addition, more social workers are needed to support drug users enrolled in court diversion programs.
So this is the place, Eva, where I would say if you wanted to be specific to streets for outreach, that this to me would be a better way of incorporating some of the key areas that have been brought up by members or our residents and our members as locations of concern that need a little bit more love and attention. So I think that this would be a better place to identify some of those areas to focus on.
Okay, I can gather it. Not sure right now which one to call out though. I think 116 and 125th, it's usually what people call out. I think Dawn has mentioned 103, is that right?
Okay. So we can say like the East 103rd Street corridor, the East 116th corridor, the East 125th Street corridor. And I feel like that might be succinct enough, but yet vague enough to be all encompassing.
Okay.
You said 103rd.
I just said the East 103rd Street corridor, the East 116th Street corridor. I actually would do the East 110th Street corridor and the East 125th Street corridor.
Yeah.
So just our main thoroughfares.
Okay.
So as this is a new item, the committee would have to discuss adding this item to our tracker. Marlene, if we're adding new items, do we vote on it, or is it just general concession or verbal?
It's just a verbal agreement. So the new members of the committee, where the budget tracker for, if you guys can remember, I just like in the sake of time for moving screens, but where it says fiscal year 2023 tracking code, new, an asterisk with the word new would go there, and then this entire row would go to that. So the new items are always placed on the bottom. So these are all expense items. So I think your last budget request, the existing one was a DIFTA one, so it'll go after the last DIFTA item as a new, because it does not have a tracking code. It's new, so it does not exist for 2022.
So I'd like to open up to the committee members for discussion of your support, comment, objection to adding this additional item. I don't know if Xavier is on. I know Xavier, we've talked about how to identify some of these key areas before. So I just want to make sure that we're covering some of the named streets accordingly.
Yeah, can you, sorry. Okay, more peer outreach, that one right there, number 2.
Yeah, we just added.
Yeah, sorry.
So Eva's asking for us to add these additional items to our tracker. So we finished the part that was carryover from last year. These are new items that Eva's introducing. One of them was to address key areas across the entire district that might need some special attention. And so we were going to revise this particular item to put in the key thoroughfare corridors, East 103rd, East 110, East 116, East 125th Street, so that we're not talking loosely, but kind of specifically about areas where additional social workers and outreach workers could be of use.
I would say that specialized teams, given the city's budget, their response is gonna be, well, we'll see how much is in the budget, and but I think if we specialize with, they're either going to respond that way, or they're going to say it needs more study down the line. But I'm fine with doing that because that is an area of focus that we have seen an uptick. I think it's just trying to think of the language to use with that.
Well, Eva used the language from the reference guide. So she picked those
I think that's,
specifically.
I think that, yeah, then I think that's fine. We
Okay.
will see how they respond.
Okay.
Yeah.
So are there any other comments or from the committee? Okay. I'm gonna then ask Marlene and Eva, or excuse me, Eva, to go to the next item.
The next one says we need program to address other public health issues. Newer, less lethal drugs are available as an alternative to methadone, but lack of funding is usually cited as the reason why the drug is slow to be adopted. An independent nonprofit should come and assess whether there is a subset of the greater than 7,000 methadone patients who can benefit from transitioning to newer, less lethal drugs, and to help with the transition. So this would allow patients to reduce frequency and distance travel to obtain drug treatment in Harlem.
So as this is a new item, I'm opening up the floor for the committee members to discuss whether or not this should be added, revised, or removed.
It is also consistent with Governor Kathy Hochul's proposal to make these drugs more easily available.
So I'm not seeing any hands raised for comment on this one, Marlene, or any discussion.
Mhm.
So what do we do? There's no one said anything. So do we?
Well, lack of response means that you're agreeing with Eva.
Okay, by
Yeah,
default. So by default, it's on. Okay, it gets added. Next one.
Next one is to provide mobile drug treatment support to residents in Rhode Island. A portion of the roughly 1,200 residents of homeless shelters on Rhode Island suffer from chemical abuse, yet there's no drug treatment service on the island. Mobile treatment unit can improve healthcare accessibility, thus increase chances of user accepting treatment.
So this to me sounds like a capital expense because it's a unit, right? That be provided. I see that you have down H&H.
Really, even mobile unit, it's capital. I don't know how it works.
Yeah, it could be. It depends. I mean, I see all these mobile units doing the vaccinations, right? And the testing. So
Exactly.
some of those, assuming we come out of this pandemic, may be able to be repurposed.
Exactly.
So I'm going to open it up for discussion to the committee as to whether or not we are going to revise the language, add it, remove it. So the floor is open for committee members to please raise their hands to comment or share questions.
Isa, may I ask a question?
Yes, Marlene, even though I'm not Eva. Yes, Marlene.
Okay. So your reasoning says to provide mobile drug treatment support towards island shelters. That's a reason. A portion of the 1,200 residents of homeless shelters on Ward's Island suffer from chemical abuse. It's backing up to the reason. Yet there is no drug treatment services on Ward's Island. Mobile treatment unit can improve healthcare accessibility and thus. Do you need that sentence? It's up to the committee. Yet there is no drug treatment services on Ward's Island.
I feel like it should be revised to request. Like there's no actual request in that, right? So we're requesting.
It's just a statement. I mean,
Yeah,
the
I feel
rest
like
of the
it needs
sentences
to have
are, yeah.
an action.
We can remove the first sentence, and then at the last sentence, we says mobile treatment unit on Ward's Island.
Requesting a mobile treatment unit be deployed to Ward's Island.
Okay.
To provide these services.
Yeah.
On a scheduled and consistent basis. Because I don't want it to show up one day and it never comes back again.
That is for sure. It should be there every day, really.
Yeah.
Yes.
I mean, that's a number one concern of the
I think I'm
residents
mentioning
and the
each of
provider
them.
for these shelters are people who are really addicted to drugs in the shelter.
To increase.
Healthcare. Yeah, okay.
And this one, but this, my question was to this one, right? This statement, it's up to the committee, but do you want it?
I think
No,
it's
we would-
important though.
Is it
We would-
true?
It is true.
I think we should remove it because I do think some of the providers might have partners that they're referring other people to, whether they're on-site or off-site.
No,
I don't think. My recommendation is that we remove the sentence
Okay.
and go right to the request. So the request is to provide mobile drug treatment support towards island shelters. A portion of the 1,200 residents of the homeless shelters on Ward Island suffer from chemical abuse, requesting a mobile unit be deployed on Ward's Island to increase chances of users accepting, or I would say to provide shelter residents with treatment.
Hold on. So look, now it doesn't read clearly. So it says a portion of the 1,200 residents of homeless shelters on Ward's Island suffer from chemical abuse. Requesting, should you say a mobile treatment unit?
I would just say requesting mobile treatment units. So I would remove the A, requesting mobile treatment units be deployed. And I don't know if it's on Ward's Island or to Ward's Island. I almost feel like it should be to Ward's Island, but
can I ask a question?
To increase treatment access, and I wouldn't say the rest of it because it's to increase treatment access. I'm sorry, Pastor Scott, please, the floor is yours.
No, I'm sorry. I didn't raise my hand. I was just wondering that little, I agree with you to omit that, but do you think that it might help strengthen the request if it is mentioning, because if you mention numbers, I guess it's important to mention that there's zero treatment being already there present for them, which will probably strengthen the request.
That would be debatable. So some of the facilities there have referral partners, or they may have mandates with Oasis that they are, like, for example, the one that came to us before is just a screening triage shelter. So people come there and then they triage them and then they refer them to other programs and services. So I don't think that we can blanketly say they don't exist, because each of the shelters that are there have different requirements on what they're supposed to do. They're not all the same shelter. So, you know, one's a men's facility, one's a triage facility, one's something else. And based on their funding and what their certification is, if they are referring to someone else as a partner under the guidelines of the state, they may be deemed as providing that service because they have a partner that they refer people to for that service. You know what I mean? So I think we should, because it's not one size fits all, be more kind of global in the language and say, the issue is there are people there that need services, A. B, we are requesting a deployment of mobile units to increase their access to treatment, right? It's really that simple. To increase access to treatment while they're on Ward's Island.
Right, so the point is not that the shelter may have alliances with other drug treatment centers, but there is none on Ward's Island that they can have a connection with, because the Odyssey House on Ward's Island is self-contained. So this request is all about making it more accessible.
But for example, Eva, I know like the Help USA site has medical people that come out several days a week.
I know, but it's not for drug treatment.
I understand, but I think we're getting into semantics that we don't need to get into for the wording on this. What we want is for them to deploy the units to Ward's Island so people can get access to treatment while they're there residing in the shelter.
Insufficient, because it is, I think making a stronger case is important, but I mean, it's up to you. I trust your judgment.
It's not even about a judgment. I just think it's not one size fits all. So each of the shelters provide different services and have different populations. So unless we're going to identify everything specific to each shelter, which I don't think we should do, and again, that facility might say it is sufficient, depending on the number of people that they're moving in. Their funding from the state might say it is sufficient. So I don't think we should get into that semantics. We are trying to address the fact that there are people on Wards Island who need services. And instead of them all traveling into this, over the water to get it, we could be bringing the services to them. And I think that that's a more holistic, to use Xavier's term, approach to have, which is we should be able to bring the services to them. Okay. Does anybody have any other comments, questions, objections before we add this item? I think it's an important one. I almost even think, Eva, and this is really up to you, is whether you should put the second sentence first. A portion of the 1,200 residents of homeless shelters on Wards Island suffer from chemical abuse.
Yeah, I agree. I think it's better to remove the first sentence to merge it with the third sentence.
Well, yeah, I think you just take the second sentence and it makes it the first sentence. A portion of the 1,200 residents, and I would just say, in order to provide, or requesting you provide, yeah.
In order to provide, exactly.
Yeah. In order to provide mobile drug treatment support to Wards Island shelters, comma, requesting blah, 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 blah. Okay.
Where do you want to put that, Nye?
So a portion of the 1,200 residents of homeless shelters on Wards Island suffer from chemical abuse. Then the next sentence should say,
this should be, I'm sorry, just to not be offensive, it should be chemical misuse, not abuse.
Okay, thank you.
Thank you for that, Marlene.
Yes, I want to make sure we are being respectful of all.
And where your additional, just
so then instead of two, it should be recommend providing. So take out the two. Yeah, providing. So recommend providing mobile drug treatment support towards island shelters, requesting mobile treatment units be deployed towards island to increase access to treatment. And that's it. And it looks like we're adding that. Next item. Now, I see this item is about HIV AIDS, and we had a previous item on HIV AIDS. Oh, okay.
It's not about HIV AIDS. It's just how the guy
category. It's the category. Okay.
Asked us to write. This is about funding a health outreach effort to educate people about booster shots for the vaccine. The funding for health outreach effort is needed. Repeated booster shots would be required to address COVID disease in a way similar to the flu, since neighborhoods of color, including Harlem, continue to have lower vaccination rates. Additional funding should be provided to help raise awareness of the benefit of vaccination through outreach efforts, e.g. to hire more outreach workers and to advertise.
So I know that there is a very big push and effort regarding the booster and vaccinations. The mayor had a big press conference about it this afternoon. They've already rolled out for Pfizer, and they were talking today about the rollout for Moderna and then J&J. I think that with the incentives and other programs that are being offered, there is a keen awareness. Luckily, East Harlem actually isn't in the top 5 anymore. The top 5 unvaccinated or low vax sites are now in Brooklyn, Queens, and Staten Island. So we've done a very good job of increasing our numbers, but I don't think we can, as they say, take our foot off the gas. So I'd like to recommend to the committee that we add this so that we can continue to make sure that the numbers stay low and that there aren't any spikes. I just see a typo in including in the end of the second line. So since neighborhoods of color, including East Harlem, it just has an extra N at the end that needs to go. And I would say East Harlem because we want to be specific. Or you could, I guess, East and Central Harlem, or we can say CB11, but I just want to make sure we're being specific. So I'd like to recommend we add this item to make sure that it stays a top priority. And so I'm going to open it up to the committee. If anybody would like to raise their hand, if they have any comments, questions, or suggestions or objections about this item. Okay, seeing none, it looks like we're going to add that one, Marlene.
Mm-hmm.
Okay, next one, Eva.
Next one is culturally sensitive program. Maybe we don't need that because we incorporated all the language in the previous two. So
I would like to recommend that we remove this one since we have tried to address it previously, and because those other items are already in the budget tracker and are part of an open discussion with the various city agencies. So it's always good to be working from building upon something that's already in the discussion and in the tracking pipeline than starting a newer item. So if there's anything, Eva, that we need to do to further tweak the previous one, I think, we could do that, but I don't think we need another new item because we've now incorporated.
So I think the only thing about here that may be worth incorporating is the need for translator and also culturally sensitive meals.
So I would recommend we revise, either we revise the previous or we make this one just about that, like culturally sensitive programming, culturally sensitive meals, and rapid translation.
Yeah.
I'm sorry.
Yeah, I think, Marlene, you might want to show more because some of them are cut off. So yeah, we talked about caseworker, in-home care workers. So the only other thing I have is translator and culturally sensitive programming, such as culturally sensitive meals, English as a second language classes, Tai Chi classes, and celebration of Asian festivals.
So I feel like we have two things we could do. We could make this one specific to Asian, the way the other one was specific to Spanish, and not combine those two. Or we can make this one about the other services, right? So sensitive programming, meals, translation, and I feel like rapid translation of all information and materials. Because I still come to feel like seniors are saying they're not getting stuff in the languages that they need.
They're not, yeah.
Marlene,
do you all
have
want to revise it right now and just make it be for programming and meals?
Yeah.
Maybe just Asian, maybe easier to track as well.
Yeah, I would say maybe we go back and we make the other one just Spanish,
Mm-hmm.
and we make this one just Asian, because before we tried to combine them, I think we could have two separate ones.
Yeah.
Okay, just hold on. It will require me moving screens. So let's do one thing at a time. And I really appreciate everyone's patience. It is 8:30. But I wish we were in person because it would be easier just to move. But that would require me taking down the screen. So let's do this one before we jump to the other one. What do you want to do with this?
So it looks like what we would like to say is there's a need for more culturally sensitive social support, I would say, for Asian seniors.
So you want to take off this?
No.
Leave the first sentence.
I'm just in the first sentence. Instead of the word two Asians, I would say support for Asian seniors.
Support for.
Yeah, 4 as opposed to 2.
Mm-hmm.
More than 8% of East Harlem's population are Asians. Among them, the senior, but limited no. Okay, sorry. It takes what I'm saying and puts it on the screen while I'm reading it. So forgive me.
It's okay.
Okay. Funding is needed for social service providers that support Asian seniors, including, I would take out areas that require, I would say including funding for
Funding for,
And then you could delete and go to bilingual, should be the next thing. Bilingual caseworkers, in-home, is it called in-home care workers or in-home healthcare workers? I don't know, whatever that right term is. And translators, I feel like bilingual caseworkers, translators, sorry, it keeps popping up as I speak, so it just makes it a little hard to read.
including funding for bilingual caseworkers, in-home care workers, and translators.
As well as culturally sensitive programming, culturally sensitive meals, English as a second language classes. I would just say, etc. Because festival celebrations may be considered under someone else's jurisdiction.
Wait, culturally sensitive meals, English classes, Tai Chi, you want all this out? Is that what you're saying?
No. The only thing I was saying to take out was celebration of Asian festivals, because that might not be considered under their jurisdiction.
What about Tai Chi classes?
I'm fine with you leaving that in.
Oh, sorry.
Yeah, Tai Chi is fine. I was just saying the celebration of the Asian festivals might be under someone else's jurisdiction.
Is that a lowercase c?
That's close enough. I don't even know.
All right. So this
Girl,
is,
you better Google it, sister.
My mom does it every day.
That's beautiful. I love watching.
so you all can read that and see how that reads.
It seems fine, but Eva, just double check. Okay. So does anyone have any objections to this and to adding this and making this one Asian specific? And Marlene, of the previous one, I know you don't need to switch screens now. We trust you.
I could switch it.
We trust you when this is finished, just to make the other one about Spanish. And since this one's going to be about the Asian community.
There were a few of them. That's what I need clarity from you all about, right? I'm being very meticulous this year on purpose.
So I can help you. Why don't you search for the word Spanish? Just do Control F. Spanish. You'll get there.
It's in the other grid.
It's in a whole nother document. So let's finish in this document and then we'll be done.
That's it. I think the rest are for housing and for eco-dev.
This is HRA. Oh, you did this for the housing, Eva. Okay.
Yeah, starting at number 7 was for the other committees.
Okay, no problem.
Yep, awesome. So we have decided to add several items. So thank you everyone for your patience.
Let me go to the other one so you guys could here's your tracker. Okay, so it was a DFTA request. It was one of them. Spanish, so provide funding to hire more Spanish speaking home care workers. This one? Provide
yes.
Okay. And this one, I think it said include Chinese.
Right, so we just delete it. We'll just keep it as is.
No problem.
Then I think we're good. Are there any other items?
Then there's another one, I think. If you search for Spanish again, it's on the.
Was it the
Yep.
Spanish speaking?
No, but you highlighted column D. It's in a different column, so you need to put your cursor not on column D. Highlight all the columns and then do Control F. Yeah, perfect. Yep. And then do Control F Spanish.
Mm-hmm.
There you go.
Okay, so provide funding for more caseworkers. Oh, this was the one that you took a
Right,
while ago.
we want to modify, but we will remove Mandarin and Chinese from here.
Oh, I see. No problem.
I think that's it.
Okay.
Yeah, good stuff. Thank you, everyone. Sorry.
No, thank you. Thank you, Eva, for your work. Thank you, Marlene, because I know we are on a tight schedule. We have less than 48 hours to get this submitted. So thank you,
Okay,
everyone.
let me go back to.
I know, thank you, Marlene, for your help in advance of this meeting.
You're
We
welcome.
managed to pull it together in 24 hours.
You're welcome. Okay, let me go back to your thing. The last thing on your agenda, Nye, is
It's the questions.
the
Mhm.
questions.
So
Oh, you need the questions. Okay, I need to.
We've shared it, but I'm just
Okay.
gonna do a little opening. So we do have an old business, which is a work in progress that started last year when I came on as chair, which was we as a committee agreed to use and dedicate time to each meeting for a COVID update for the community, and to have service providers across the community in the health and human services space come and introduce themselves to us. The district office staff has embarked on the process of reaching out to the service providers to get the most updated information, so we know who the point of contact is, their phone number, their email, what services they provide, of course, what portion of their services are provided to people in the district, what services are outside the district, and just to create a safe space for a dialogue to better engage our service providers in all areas of the community. So several members of the committee and the district staff have been working on a questionnaire so that we could gather information. Marlene, would you be able just to do a quick screen scroll? We don't need to go over line by line, but just so that those members of the public or anybody else could just see what it looks like.
I have to stop sharing this.
Okay. And so we're putting this together so that we can reach out to the community service providers and to better engage and get to know them, and to be able to create a space where they can come and update us on their services, on budget needs, considering this, what they're seeing out in the community, what more we can all be doing to better serve the residents, especially post-COVID. So every time going forward, every month, there will be a section dedicated to an update and a presentation by one of these providers. Marlene will assist us in that invitation. Once we do the invitation, we would send them the questionnaire, which would then be come back and shared as part of their presentation. Marlene, is there anything else?
No, we just plan on really starting this next month. Yep. Just to adhere to the resolution that was created and sent out in March of this year, sorry, 2021.
So if many people remember, we voted on a moratorium for an 18-month window to prevent any additional sightings of treatment facilities to allow us a chance to assess what exists. But we're also using this as a bigger opportunity to understand what are all the services in the health and human services arena that exist in East Harlem. Many people are often saying that there's a lack of resources here. We as a committee believe and know from our members and our discussions and presentations that there actually is a very robust range of services here, and we'd like to be able to learn more about their work. As I say, create a dialogue and amplify those services so that people know that they exist and can take advantage of them. And so it's really some basic information. It's contact information. It's information about the organization and about their services. Marlene, if you could scroll down just a little bit.
Sure.
And then some other key information about the organizations that we could use to then pretty much start a portfolio and have that information readily accessible to our committee members. This also includes understanding where CB11 has on board. So for example, the Community Advisory Board at the Henry J. Carter Center, CB11 has several seats. CB11 is part of the East 125th Street Task Force with Councilmember Ayala's office and Assemblymember Robert Rodriguez's office. So just to kind of understand where we have access and to start bringing those community members and those organizations to the table to present. Eva, did you have a question or a comment?
Yeah, my question is, should we put this on some sort of Google survey? What is it called?
Like one of those, like with the drop-down boxes, like a Google form, like a G form?
Google form, exactly. Sorry, I forgot about the term.
Yeah, I think it
It
can
may be
translate
easier.
for the purpose of sharing with the community and the public today, that this was really important to just be able to show it in a more linear fashion so that the community could see it. I think when we share it out to providers, yes, that we could do a nice Google form drop down to make it easier and less time consuming for them. I also feel like it could be and may need to be combined with the speaker form, because there is a different speaker form that CB11 uses, especially if someone's coming with a request for support or, you know, request for anything that has dates and deadlines. So we may need to look at how the two of those interface, because they're two separate things. But yes, I think it should be converted to a Google form and done so in a way that is, you know, easily accessible and easily able to complete for the organization and for us to review and have, as I said, a portfolio or record of consistent questions and consistent information. Yeah. So this is just a follow-up for the new members and members of the public. This is kind of phase 2 of our process of getting to know who the service providers are, so that we can, as I said, better amplify and support so that we can make more sound decisions about budgeting and services where we have input, and to be able to better opine about needs for services, changes in services, or support, letters of support for service requests or extensions. So is there anything else, Marlene?
No, I think you covered it.
So there's a recommendation to have the East Harlem Consortium of Service Providers. I think we can add that to the list. It's a long list, so I warn you all, you know, we're giving them between 10 and 20 minutes of presentation time every month. That means we will not cover the entirety of all the service providers in one of our cycles. So it may take us a long time. We might need to have 2 presentations, you know, depending on what else is on our schedule. The budget was a very important part of our schedule, which took a long time. So each month, Marlene and I and the executive leadership will think about the best way to incorporate these presentations, again, as more of an educational opportunity for us and to build better bonds and be better engaged with service providers. Marlene, is there anything you want to add about that? Or I don't know if Xavier's here, if there's anything you want to add. Thank you to everyone who's worked with us to get these questions together and streamlined so that we can have an accurate record and be consistent in our conversations and the information that's gathered and shared.
You have hands raised now from Eva and Xavier.
Great, Xavier?
Eva can go ahead and then I'll follow up.
Great, Eva? I'm sorry, Eva, I thought it was down from before.
Yeah, I have a new question. What are the methods to prioritize which providers to come first?
So my understanding right now is that we were going to start with the larger providers and kind of work our way down. But we're also looking at providers that have maybe been to us recently. So we might, you know, go down the list to the next one, because there are some service providers who've presented to us in the past couple of months. So, you know, we'll go down the list from there. It also depends on just what information we have. We do realize that post-pandemic, some people are remote. People may have changed jobs. So as we're going down the list, if, you know, we don't get the right contact, we're just going to go to the next organization and keep moving. Because as I said, there's way more organizations than there are meetings on the calendar, since we only meet once a month.
Yeah, I think for the small one, maybe we just review their survey results. If we don't have questions, they might not need to come present. And I
think we should put it on the agenda for next month. We should put it on the agenda for next month to review how we address, because again, we only have now until June, July. And so how do we get, a nice consistent, it's also based on availability, because sometimes we invite people and they're not available on the day of our meetings, or they may not have someone that they can send on the day. So, we'll have to have some flexibility. But yeah, we're ready to start going down the list and having some presentations and discussions.
I was going to say, if I may, because some centers have multiple facilities in East Harlem or East and Central Harlem, I think it may be better if they can present the data in aggregate to also help reduce the number of times they have to present, and then we get a better sense of the provider.
Agreed, but I also do want to make sure that we're getting East Harlem data. We can get East and Central is fine, as opposed to say Manhattan, because some organizations cover multiple sites across Manhattan. But I also want to make sure we're being consistent. So whatever we ask has to be something that, if you're a small organization, if you're a large organization, if we needed to do some sort of comparison, it's in a way and presented in a way that will help us better process the information we gather as we need to for decision-making purposes. Thank you, Eva. Xavier?
Yeah, so thank you very much. We've been trying to get this work done for quite some time. My question, actually, I think it's good that we start inviting everyone in. We'll be able to separate those people who've been here in the community for a long time prior to having methadone as a part of their services very quickly. I'd like to kind of turn the page onto, I thought we were supposed to have some information provided with Harlem Yes and the World's AIDS Day. Was that not put on the agenda? I saw an email from
the last time that I saw correspondence, it was being kicked to executive.
Okay, all right, very good.
But I defer to Marlene. Marlene, if we needed to vote on something here, last time I saw it, it was going to NILSA.
Okay.
Yeah, you're right, Nye.
Okay, so my
on the committee's behalf, I will just double check with NILSA tomorrow. Xavier, we could just tag team it.
So just so that everybody's clear.
It.
Yeah, no worries. Just so that everybody's clear, Xavier is referring to a request that came over from Harlem Yes in support of a World's AIDS Day activity. In the past, I joined Xavier at the event that they held previously, which CB11 lent their support to as a partner. And that request was made by Patricia Martin, who's one of our Health and Human Services Committee members. And she is asking support or partnership for the upcoming event. And I believe she could not be here today, but that request was passed to executive, and we can follow up post committee if there's anything else we need to do to support that between now and full board.
Okay, thanks, Nye. Thank you, Marlene. Yeah, it was an event 2 years ago. They didn't do one last year because of the pandemic. Thanks. I will follow up, Marlene. I'll follow up. Thank you.
Marlene, is there anything else?
No, that's it. That's all. That's on your agenda. I'll just take the attendance again one more time after new business, if anyone has any new business.
Yeah. So is there anyone on? I know that I didn't really see any other elected. Sometimes I know Gail Brewer's office is able to attend. Is there anyone with any new business or an announcement or information that didn't get covered in the announcement section? If you could raise your hand, otherwise you're welcome to drop the information into the chat if there's an event or activity coming up that you would like to extend an invitation to the community on. Okay, seeing none, I'm going to take a bit of chair's privilege because I don't think we'll see each other, most of us, until full board, to remind everyone that early voting starts for all of the citywide races and also a special election for the Senate race in our district. Early voting starts this Saturday, October 23rd, and extends until October 31st, with, of course, the final day to vote in the general being November 2nd. I'd like to recommend that everyone, Googles NYC votes. If you don't know where your poll location is, you can visit nycpollsitelocator.com and enter in your address. just note that for early voting, there are kind of regional sites that are probably not your normal poll site, and your normal poll site will be open on election day. So please be sure you know where to go vote. Today was the last day to request an absentee ballot, but also during early voting, if you want to skip the lines, each election office is open, and you can even go to an election office and vote in person during early voting if you are concerned about COVID or socially distancing, et cetera. But I want to make sure that we remember to step up. Part of the survey that was conducted, one of the things that was mentioned was increased civic engagement and informing our communities on how they can be civically engaged. So I want to remind everyone, take your friends, take your families, tell your neighbors. Early voting starts on October 23rd. Anything else, Marlene? Otherwise, I'm going to kick it to you for the roll call to close out. And I just want to thank everybody. I know it's almost 9 o'clock, but we appreciate you, and this work is crucial.
I don't have anything else. I can go into the roll call.
Great. Thanks, Marlene.
Sure. Eva Chen.
Hello.
Sandy Garcia. Robin Krinsky. Has excused. Jennifer Meyer.
Present.
Thank you. Shirley Pena. Arturo Perez.
Present.
Thank you. Xavier Santiago.
Present.
Thank you. Pastor Isaac Scott.
I am present.
Thank you. Robin Strations. And Nye Whitaker.
Present.
Thank you. You still have a quorum now. Good.
Great. So I think we can close out by verbal decree, unless anybody wants to stay a little bit longer and go over some more budget tracking items. I think we can close out for tonight. I thank you all, to the members of the public, to the members of the committee for doing this hard work with us. Our community needs us and needs some love and attention. And so I appreciate everybody's extra effort and extra time this evening. And stay tuned. Budget District and Needs is meeting on Thursday. Is that correct, Marlene?
It's meeting tomorrow. District Needs tomorrow.
District Needs is meeting tomorrow. So there will be a final update of the items that are making it to the budget tracker going forward. So please stay tuned for additional details. And I hope to see everybody at the full board meeting at the end of the month. Good night, everyone.
Okay. Good night.
Good night.
Good night. Thank you.
Thank you.